Welcome back. You're watching Girl Talk. We're down Monona Drive at the Ultimate Veritas Spa. Lots of things going on here today, as you can see around us. We're dressed in pink today, celebrating Karina's baby girl. Anytime.
Anytime, really.
Preferably not right at this moment.
Well, you might see me run off in a little no.
But we wish you well. She was trying to cross her legs earlier. It was
It's not working.
not working today. We're also looking at a makeover later on. This is a very girly episode. Who doesn't love a good makeover? Hair and
lashes.
Lashes?
I'm
They're doing
excited for
lashes?
this.
Okay, it's always so fun to see. Also with women, more serious topic is thyroid disorders. And right now we have with us Dr. Ashley Woyak. She's the owner of Forward Natural Medicine. Thanks for joining us today.
Good morning.
With all of our shenanigans going on.
I'm kind of out of place here, but where's your pink scrubs?
Yeah, that's true. I should do that next time.
Yeah.
All right, the thyroid disorders, pretty serious thing and frustrating thing for many, many, many women.
Yeah.
Let's start a little bit at the beginning. A thyroid disorder doesn't necessarily come to someone the same way as someone else. Lots of different ways you can have that happen. Is that right?
That is correct. So most medical doctors, they just look at TSH, which is one of the main thyroid markers. So to them, there's only one way you can have a thyroid problem. But when patients come into my office, after looking at research, I know that there's over 22 different ways you can have a thyroid problem.
Wow.
So I need to look at all of those, because if you have symptoms and your doctor's saying your TSH, your one marker is normal, then we need to look at other patterns.
That's amazing. Why wouldn't they be looking at those other things too?
It's just kind of like the research, they're not really taught that in medical school, and it just hasn't been updated, and they're so busy that that's what they're taught, so that's what they go to.
Sure.
You know, that's
So,
yeah.
Ashley, you mentioned 22 different signs? Markers, wow. And
Yeah,
so,
well, over 10 markers, but there's over 22 different patterns.
Okay,
So
I
you
see.
need, it's almost like detective work. Let's look at your markers, let's see where that pattern is or that problem. Let's figure out why it's happening.
wow. And so then what would be some symptoms to look for?
There are so many different symptoms. A lot of women can't, like, they are exercising all the time and not eating, can't lose weight, so they're so frustrated, and I feel for them. That's really frustrating. They have dry, thinning hair, they have digestive issues, anxiety or depression or just brain fog. They just can't think throughout the day. There's a lot, so those are the most common ones I'm seeing.
So I bet a lot of women at home can relate to some of those symptoms that you've just described, maybe many of those symptoms that you've described. Why is it so important to have this diagnosed, and why is thyroid hormone so important?
Because your thyroid it controls so many other parts of your body. So it controls your sex hormones, it controls your fat metabolism, parts of your immune system, your sugar metabolism, so do you have diabetes, your cholesterol, and more. So sometimes patients can be on 5 different medications for 5 different things, when really it might just be one underlying problem that maybe we can get a hold of, control.
I've seen that in so many people, where they're just adding medications and going to different specialists, and really it's all could be caused by one thing, we're just missing it.
Yep, a lot of the women I see, they're on thyroid medication, they're on like a acid reflux medication or something for constipation, they're on an anxiety medication, so it's like, well, if we
Nobody
can
wants to take all that.
No, and the long-term side effects. So,
right.
Yeah.
All right.
Wow, big topic.
So very frustrating and elusive, I bet, when you're chasing all those different symptoms.
Yeah.
So let's go back to why labs might come back as normal. You go in, you get your test, and the doctor says it's normal.
Yeah, so a lot of the patients are women, they have these symptoms, they're like, oh, I'll go to my doctor. The problem is they only run TSH, the most common marker, and then when there's 10 other ones we should be looking at, and then when they only get that one marker done, the lab range, like the reference range that doctors use, is very broad. And so you have to have a number, like value, way outside of that range in order to get a diagnosis. The range I use in my office is more of it's called a functional lab range, and that's where a healthy person should be at. So I don't care the medical range, I want you to be where a healthy person should be. So you could have symptoms, but you're not bad enough for a diagnosis yet.
Ashley, we're almost out of time.
Okay.
You have an event coming up you wanted to mention.
Yes, I do. So Thursday, November 8th at Table Wine on Atwood Ave, 5:30 to 6:30. I'm doing a thyroid talk, the 5 biggest myths about thyroid disorder and how they're kind of holding your health hostage. So wine's included, and all the proceeds will be donated to Underdog Pet Rescue.
Dr. Woyak's going to let us drink wine.
I know, yeah. I'll pick out a good one. Yeah.
All right, and you get to meet the doc. All right, thank you.
Thank you.
Dr. Ashley Woyak, she's the owner of Forward Natural Medicine. We're Girl Talk, and we'll be right back.